As a nurse at Munson Medical Center, I feel that I am supported in ways that I haven't really felt before. We're a small community. The hospital feels like a small community, although quite a decent sized regional referral center. I still feel like we're not just one fish in a fishbowl. We've got great teamwork and collaboration among everybody that works here. And that's one of the things that really drew me, is that there were those support measures in place.
They allowed me 5 to 7 weeks of orientation. And then once I transitioned onto the night shift, I had something called a buddy. So it's a seasoned or experienced nurse that is available to you to ask questions. And they're really friendly. There's great teamwork at this hospital.
The most important things to consider when trying to find your first job is really looking at the environment in the hospital and that camaraderie, and you can really feel like you're struggling someday. So having a really strong support group has been really important and has really made me feel confident that I chose the right place to start as a nurse.
The best part about Munson Healthcare has been, my opportunity for professional growth. I think everybody has taken a vested interest in me as a personally and professionally. I started as a graduate nurse, was able to, get my RN license while I was here. I went from that to a nursing manager role, to a nursing director role, and then, eventually to the VP CNO role.
Traverse City area is very similar to Marquette. We're really close to the bay. And they always say that Marquette is kind of becoming the next Traverse City.
The patient population is very similar to the patients that we experience at Northern Michigan University when we're doing our clinical rotations in hospitals and community settings. So it was an easy transition in terms of patient population.
I couldn't be happier. I think that many times in a large organization, individuals, especially without any kind of connections to the community, can kind of get lost in the shuffle. But that was not the case here at Munson. I was 100% supported from the day I walked in.
I would definitely recommend coming here if you want to start right out of school, getting into critical care. I would definitely recommend joining the residency program and just taking that leap and jumping right in there and getting into that critical care experience.